As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community.
All right, welcome back to Your Health with Terrebonne General Medical Center. Our guest tonight, let's introduce her, Dr. Christine Albrecht. Welcome to the program, Doc.
Thank you.
Appreciate you being here tonight. Osteoporosis. Big name. What is it and how does it occur, first of all?
Well, osteoporosis is a disorder of low bone mass. It's not necessarily a disease, it's more of a condition. It occurs naturally with aging, and the risk of acquiring osteoporosis, I mean, it's multiple factors. Genetics, our age, our nutritional status as children, and certain diseases that we can get can also play into our risk of getting osteoporosis, as well as medications we may take.
Okay. Any specific causes for osteoporosis?
Probably, I think the biggest cause is probably just genetics. Some of us just genetically are going to be born with stronger skeleton than others. People, basically, particularly at risk, are small-framed women. Caucasian or Asian women tend to be born with lower bone masses. And then how we live our life then affects our bone mass. We always think as our bones is like stable, like a rock, like it's just your bone and that's how it is, but that's not true at all. Our bone is constantly changing throughout our life in response to the stress that we put on it. So a bodybuilder is going to have a much stronger skeleton than a small sedentary person because he's putting a lot of stress on his bone. His bone is going to respond and become stronger.
Okay, makes sense to me. Who is at risk?
Well, if you have a family history of osteoporosis, that's probably one particular large risk. As we get older, for women, menopausal women are at particular risk, as are older men, over the age of 70. Certain diseases will greatly increase the risk, like hyperthyroidism, Graves' disease, gastrointestinal disorders like Crohn's disease or celiac disease, people who've had to use certain medications chronically like steroids. Some of the medications that are used commonly now for the treatment of breast cancer, anti-estrogens, can affect your bone density, as well as certain kind of birth control methods. Anything that basically are going to lower your estrogen levels for women are then going to predispose you to developing osteoporosis.
Okay, and it says too little calcium in the diet. People don't drink as much milk as they used to?
No. I think that dietary status really largely affects it. In the United States, we have pretty good nutrition, but as you look worldwide, there are a lot of people that as children, when our skeletons are developing, are not going to get adequate calcium and vitamin D to build a healthy skeleton. Basically what happens as people, like our skeletons increase in strength till we're in about our mid-30s. That's when we have our kind of strongest skeleton. And then from there, it's all downhill.
Wait, I'm 51. I'm over the hill?
Well, no, not by my definition.
Okay.
But yeah, from our mid-30s, there's a gradual decline in our bone strength. And then particularly for women, once we reach menopause, there's going to become a much more rapid decline from that point on.
Okay. Now, the symptoms for osteoporosis, can you go through those with us?
Well, there are no symptoms of osteoporosis or osteopenia. So osteoporosis is going to be a very low bone mass, and osteopenia is just a lower than normal bone mass. And they don't cause any symptoms until you fracture something, and that's the main problem with the disease and how doctors can make an impact on the disease.
And I see it says occurring late in disease, so you really don't have these and you'll go through them until later. in the
Yes,
process?
until something fractures, and the fractures that we see are most important, that we worry about the most, would be fractures of your vertebra, which is your spine, and fractures of your hip. Hip fractures are particularly worrisome in medicine because there's a 50% mortality rate in 6 months after a hip fracture. So osteoporosis can be a lethal illness. Vertebral fractures aren't lethal, but they are very problematic as well because they basically cause deformity of the spine. We've all seen a tiny little lady hunched over like this, and that's actually very painful. It affects their gastrointestinal and respiratory systems. So both of these things are very serious. So until you fracture, most people don't know they have the disease.
Before we go to the break, you said little old lady. How
Yes.
about little old men?
Yes, men as well.
Okay.
So estrogen for women plays a role in our bone metabolism, and for men it's testosterone. And just like our hormone levels decline as we age, that happens in men as well.
All right, very good. We're going to take a break here from Terrebonne General Medical Center. We'll be right back with Dr. Albrecht.
My husband and I have known each other since high school, and Bobby and I are very close. When I started losing my hair during my cancer treatment, he volunteered to shave his head too. My name is Sherry Starkey, and in 2007, I was treated for breast cancer at Mary Bird Perkins. 2 different doctors recommended Mary Bird Perkins, and everybody there was fantastic. And I know being close to home and family really helped a lot too. I'm still here, and Mary Bird Perkins had a lot to do with that.
Mary Bird Perkins Cancer Center at TGMC.
With the most comprehensive health care available, more people choose TGMC for life. Terrebonne General Medical Center. It all begins here.
All right, we're back with Dr. Christine Albrecht. We're talking about osteoporosis, and she's bringing us along and we're learning a lot tonight. Any test that would diagnose osteoporosis, what is it?
So the gold standard for the diagnosis of osteoporosis or osteopenia is called a DEXA, capital D-E-X-A, and it's a very, very low radiation study that can be done at any hospital or radiology center, and that's really the gold standard. And that basically tests your bone mass in your vertebra and your hip, which are the 2 most important places.
Okay. Now, the treatment options, once you decide that somebody has it or is in the stage of getting it, what are the treatment options?
It really largely depends on who you're talking to. I always tell my patient, your risk of fracturing, which is the whole point of treating and evaluating for osteoporosis, is to prevent patients from fracturing. Your risk of fracturing is based on 2 things, your age and your bone mass. So you might treat someone in their 70s differently than somebody in their 50s with the exact same bone density, because that patient in their 70s is going to have a much greater risk of fracturing. Initially, if bone mass isn't too bad and the patient's not considered at high risk for fracturing, the first line of treatment is going to be lifestyle changes, increasing calcium and vitamin D intake, as well as weight-bearing exercise. There's really an epidemic now in the United States of vitamin D deficiency. So basically all women at the time of menopause should be evaluated. Their calcium and vitamin D levels should be checked, as well as their bone density.
You said high calcium foods. What would that include?
Milk products, basically, and foods that have been enhanced with calcium. Cheese, some things that are very nice to eat.
Ice cream.
Yeah. Some of the soy milks are enhanced with calcium. They have calcium added to them. Almonds are a natural source of calcium. Some of the leafy green vegetables are also another good source of calcium.
That's not all bad. Salmon?
No.
You gotta like that.
Yes.
That's all good stuff. Sardines, I don't know about it, but you know, some
I'll eat
people
anything
love
on that list.
Some people love sardines or whatever. So, okay. high calcium, and how will the treatment eventually help people?
Well, so initially you would start out with lifestyle changes, and then in most patients we're going to be monitoring their bone density every 2 years. But if somebody's bone density shows osteoporosis, the treatment is probably going to involve more than just lifestyle changes. The treatment is probably going to also include medication, because if your body is basically, I mean, our bone metabolism is regulated by our hormones, and if your body is in a bone resorption mode, you can take all the calcium and vitamin D you want, but your body is not going to use it to build bone with. Your body is going to ignore it and keep eating bone. So medication basically changes your bone metabolism to stop it from consuming or destroying bone.
You mentioned earlier weight-bearing exercise. How key is that?
Crucial. Crucial. I mean, that, and I think that's very common for women. You don't see women lift weights as often as you see men, especially older women. But weight-bearing exercise is very important. You know, exercises like riding your bike and swimming, they're very good for our cardiovascular health. They don't do nearly as much to improve our bone strength as something like, basically weight-bearing exercise means that your body is bearing its own weight. So walking, running, aerobics, all of these things where you're kind of jumping and doing impact is actually very good for our bone metabolism. Your bone is going to respond and become stronger to support that exercise.
We appreciate you coming tonight. I learned a lot about osteoporosis, and I also learned that Dr. Albrecht likes sardines. So that's a good thing. Thank you for coming on board tonight.
My pleasure.
All right, we'll be back, and then we'll be in the kitchen with Canadas. Don't go away. You won't want to miss it.